Hello, this is Dr. Gay from First Look MRI, and these are two patients who have lumbar spine MRIs, and they both have spinal canal stenosis. Now, this first patient is 83 years old, and in older patients, often we see a combination of degenerative disc disease in the front, and then in the back, the posterior elements, the facet joints, and the ligamentum flavum can get thickened and cause narrowing from behind, and together they cause a spinal canal stenosis. So the spinal canal is the tube that contains the spinal cord and the spinal cord fluid, the CSF. Also the nerve roots, when they come off the end of the spinal cord, called the cauda equina. Those nerve roots will come down through here and exit out the foramina. But as they go through the central spinal canal, they can be pinched by either a disc herniation or these degenerative findings. So again, this is an elderly patient, 83 years old, and they don't have a big compressive disc herniation, but they do have a small disc bulge or protrusion here between L2 and L3. This is the disc. There's a little bulging disc. And in the back here, we see this mound of darkness. This is the ligamentum flavum. They have a thickening of that, and that's poking out from the back. We have a small disc bulge or protrusion from the front, and you can see the spinal canal is severely narrowed. There's no room in the spinal canal. Also, the facet joints off on the sides here can be enlarged and contribute to that spinal canal stenosis. Up here, the spinal canal is a little narrow, but not bad at all. You see the spinal cord coming down. It's not compressed. There's still a little bit of fluid around it, so no significant spinal canal stenosis. But again, at the L2-3 level, we have a severe central stenosis. L3-4, the spinal canal is moderately narrowed related to this thickening of the ligamentum flavum. We call it posterior element hypertrophy when you get this thick ligament and facet arthropathy. Down here at L4, L5, we see L4 is subluxed forwards a little bit, and that subluxation and also this posterior element hypertrophy down here are causing a severe stenosis. So two areas of severe stenosis. This can cause cauda equina syndrome, where the nerves are pinched. They can have weakness in the legs and pain in the legs, also bladder and bowel dysfunction if it's really severe. Again, this is what we typically see in people who are a little bit older or people who have subluxation of one of these vertebral bodies. They can get pinching of the nerves there. Now we're going to look at another patient who's 25 years old. Now this patient also has a severe central spinal canal stenosis, but it is not related to the degenerative disc disease. The discs are here. This is a nice normal disc. Here's normal disc. Between L3 and L4, the disc is a little bit narrowed and it's dark, which means it's desiccated, but the main finding is right here. They have a prominent central disc herniation with a little bit of inferior migration, and we can see that the central spinal canal filled with this white fluid. This is the spinal cord coming down. We see the fluid in the spinal canal, a big wide open spinal canal until we get to this disc level and we see that disc herniation causing a severe stenosis, complete cutoff. We don't see any communication between the fluid down here and up here. So this is an acute disc herniation causing bad back pain. He also has a smaller disc protrusion here. On this axial view where we're slicing through in short axis, we see the spinal canal normal here, that fluid in the spinal canal. As we come down to the disc level, we see this darkness. This is that disc herniation completely filling the central spinal canal. As we come down lower, we'll see the spinal canal open back up here. And we also notice in this patient that their bladder is large. It comes up here pretty high. Here's their belly button. Apparently they had gone to the bathroom right before the scan and they emptied their bladder, but the bladder is still significantly distended. So this may be related to compression of those nerves. It can lead in bad cases to bladder or bowel dysfunction. And so this is something they're going to follow up with their doctor right away and to try to get some advice from their neurosurgeon. But again, two cases of spinal canal stenosis, one related to degenerative disc disease in an elderly patient, and then an acute disc herniation in this 25-year-old. Thank you very much.